in very late end of the polio campaign. But still we have some time, and I'm looking very positively to engage with this very famous institution in the whole Kalimantan Bharat, and for the good of general public. So I will start with this data. Like, as you know that pink polio campaign is going on in the whole Kalimantan Bharat and in the whole country. All 33 provinces are having pink polio campaign, and it is since July it's going on. The pink polio first campaign has started in July, and the second campaign has started in the month of August. So the children who are going to get the doses are children below 7 years of age, like 0 to 9 months, and then 5 to 7 years, and then 7 years. It has the coverage of 83%, and this 75.9% with work. So actually it should be 95%. So older doses are still far behind from the scheduled coverage, 95%. It means more and more children are missed here. So if we go by the status, we can see here why pink polio is required now in this country. Because you can see that since 2022 till 2024, this the whole from Aceh to here, again from here to here, the whole circle, half of the circle has been infected by polio virus once again. And only Kalimantan and Sulawesi provinces are those which are untouched. So we cannot say that polio is not there. We can say that maybe our surveillance is not strong to detect the things. So we can say that like in December, in October 2022, first case was detected in Aceh, and then from here to here in Papua, the last case is in June 27. So now, like many people, they are coming from Aceh, from Jakarta, from Sulawesi, from Papua to Kalimantan. Okay, so they may bring the infection. So our children are at very risk, and why they are at risk? Because this is a global demand for the whole global community to work against polio vaccine, polio disease. And for that, this polio vaccine is very much important. And this is an extraordinary emergency situation where we have to save our children from the disease poliomyelitis. And to have this, these are the certain 5 points which is very important, and the global community in all countries, they are trying, they are applying these steps to fight the spread of disease and to improve the coverage of polio. And so we all know that only polio doses are the only treatment we have, because once the disease is there is no any treatment. The child becomes paralyzed for the whole life, and there is no any treatment. Only prevention is there from the pink polio, from the poliomyelitis disease. So these 5 steps are very much essential. And I think coordination with medical college is also a big requirement for pink polio campaign, especially if medical college is in urban area. Okay, sir. So why there is a requirement now, and why I am coming to meet medical college at this point of time? Sir, this is because of this reason that Kota Singkawan has not vaccinated all of its children. Only 63% with Pinsatu and 45% with Bindua. So it means still many children are unvaccinated, and there is risk of having polio outbreak here only. So like the rest of all the districts, all the regencies are having good coverage except Kota Pontianak and Kota Singkawan. So this urban area needs special attention. And if medical college is there in urban area, then I think there is nothing better than this thing. And if you go by the reasons of child not being vaccinated, then we can see like that here So the IPV coverage, the injectable, the Sutik polio coverage has never reached more than 95% in Kalimantan, Bharat. It is always between 60 to 95%. It means all our children are not vaccinated and there is high chance of having polio outbreak here. And to counter this, there is the reasons for children not being vaccinated is the Anaksakit, and which is almost 30% to 50% in the all age group, and then some people are not aware where to go. So I can say, sir, like the vaccine hoaxes are over, people are not aware about the need of the big polio vaccination, so they are not accepting. So it's like there is less demand from the community, because many people, they are still believing in TikTok hoaxes, they are hearsay, but vaccines are the real, I can say the real truth, that vaccines are preventing the disease. And if you go by the suggestions from MOH, she is Ibu Prima looking for vaccination at the national level, so she has suggested so many steps how to improve the coverage. And as we have not reached the coverage, so the ministry has extended the campaign from August to July, from August to September, and again from September it is going to be in October. So still we have 1 month's time to vaccinate the children. But if you go by the reasons, sir, the reasons lies here that many children, they are sick. They are sick means they are sick on the day of visit by the team. It is not like that they are sick in January, July, August, September. Means on the day the child was sick, but maybe after 4 or 5 days the child become okay. And this is basically due to the communication gap in the community that this vaccine is very important. And Anaksakit is not the reason to not take the vaccine. Children even can take the vaccine if they have mild fever, mild flu-like things. So to counter these things, we found in RCA, these are the certain findings during RCA, that why people are not have taken the polio vaccination. So there are a lot of reasons, but all these reasons are manageable. People can easily get convinced if someone is visiting or someone is telling them about the benefit of the vaccine, rather than going through the social media vaccine hoaxes. So these are certain observations, like sweeping has not been done properly, information gap is there, working parents are there, they are not in their houses, and team are visiting when the parents are not there, so they are not able to vaccinate their children. So infodemic is also there, wrong information in the community about polio vaccination is there. So we have to fight, we have to make people aware about the good things about the vaccines. We have to increase the demand, and with this only we can able to increase our coverage. And these are certain communication tools which we can apply to improve the coverage. So these are like the importance of to complete the whole protection cycle, to have a proper communication with the community, to talk about the benefit of the vaccine. So what I found is that communication is very much essential, because urban area is usually people are very educated, they have easy access to private sector, so they are very tough to be convinced. But when they are convinced, it is very easy for them to get their children vaccinated. So we are looking for like some communication thing, like mass campaigning through WhatsApp, through Instagram, through Facebook, Twitter, TikTok, and also like to have some famous people who can support. Yeah. So I think, sir, with this the slide, I can say that from medical college, the program needs support in communication, in making awareness in the community through the communication channel of medical college, and also involvement of medical students, maybe pharmacy students, maybe nursing, students to support to bring the community awareness at level where the vaccine acceptance will can increase. So I think, sir, medical college can be of many help. Like first of all, creating awareness among medical college staff itself, so that they can vaccinate their children first, and then they can tell other people about the benefit of the vaccines. So this can be done also with sending our students to field. Even 1 hour they can be assigned to one student, so that they can go and they can make people aware about the pink polio campaign and the benefits of taking the pink polio vaccines, and what are the drawbacks if a child is not taking the pink polio vaccine. So I think, sir, this is very much required at this level of program in Kota Pontianak, because we have almost 50% of children unvaccinated and they are at risk of getting the disease. Once we are having the disease over here, then, sir, even our children are not safe, because we are not aware that which children is drinking water from which source, because this disease is spread by fecal-oral route, and it is very easily transmitted from one person, one child to another. One infected child will infect more than 100 children at a time. So we never know that which children is infected and who is going to spread the disease. So we need to have a coordination with DHO office for generating awareness with the support of within the campus and even outside the campus also. So this is all from my side regarding this support where we can get a support from college, and how faculty of medicine and this famous institution can support the pink polio vaccination. Even if we go by our monitoring finding, you can see here that in Kota Pontianak, it is only 81% of children with pink satu and 69% children with pink dua. So again, sir, we are very far away from our target, and this program needs support from every stakeholder, and then only we can be able to save our children and to keep our children away from the disease poliomyelitis, which cause paralysis for the whole life. So that's all, sir, from my side. If there is any question, I am ready to answer. Please. This such a resource has not been utilized for pink polio campaign.
Yes.
Like you have supported Upaya,
Yes.
and so you can see that Upaya is 95% and 90%.
Yes.
So I think what you said, it is the reason why I have reached up to 90%. So definitely means I will share with DHO that he can give official letter to you, so that the practices which you employed in Upaya can be done here also, and support to the community for the vaccination will definitely go to improve the coverage. I think, sir, I was not aware of supporting Upaya. Now I can share that the Upaya achievement to this university to support this. So definitely I will share this message with DHO Pontianak to contact with you and to continue the support in Upaya here also. So it is true that in the pink book, all the records are not being maintained by the cadre, even by the midwives, they are not mentioned on all the records. Even while going house to house for RCA, we used to ask the parents that whether the child has got pink satu or pink dua. If the parents say yes, then we have marked it as yes, and also we have tried to verify from the pink book. So many places the pink books were not updated. So this is one of limitations that maybe the coverage is not there. And sir, like for the same, the problem is routine immunization also. Like suppose, sir, we can say like that our intention, even the government intention and private sector intention is to save the children from VPDs, vaccine preventable disease. So maybe this child has got vaccinated from private sector, but his records also maintained at the government sector also. Because this child is also one of the beneficiaries of all government programs. So I think this is an issue which we have to take it at policy level, because as of now there is no any policy that if children has taken vaccine from private sector, they can also be recorded in the government book also. Because our aim is to protect the children irrespective of from where they have got the vaccines. So thank you, sir, for this observation. And regarding, sir, like second point, you are very true that Pontianak is the heart of the whole province. So people are coming and going, and there is in migration, there is out migration. People are maybe coming from work only here, and then they will move to Kuburai or near about town area, which is very urban, we can say. But sir, looking about the Kuburai now, I can say that you have given me a new thing to think of to her. Maybe the Kuburai coverage is due to people of Pontianak who are coming here, but they are living and they are vaccinating there. So this at one point of time this is okay, but sir, if you see about the larger picture, children of maybe of some Bahas, maybe Benkawan, maybe Landa, maybe I can say Sinkawan, wherever children is there, the whole province, all children must be covered. So maybe one province has less coverage, another one district has less coverage, another district has more coverage. But overall, the province coverage should also be more than 95%. But here, if we can go by this coverage, then still we are quite below the required number. So basically, sir, to solve this problem, that's why there is RT-wise list of children is required. Means before the campaign, the cadre has to prepare the list of all the families who are living in that area, and they are the denominator. Means they are the list of beneficiaries to whom the vaccines has to be given. So this has been not done before the campaign. So this is one challenge why we are not vaccinating more children, and we are not aware where children are. But sir, as of the RCA findings, still there are many families who are not aware about polio. Still there are many families who are not vaccinating their children due to hoaxes. Still there are many families who think that if our child will get the tetanus, they will have fever or something like that. So all these are myths. If you have supported in immunization, so the problem in immunization is the same problem in polio also. So I think with your experience or learning of previous campaigns, definitely sir, your university is going to support this campaign in a very big way. And I think sir, if Pontianak will have greater coverage, the whole province will have greater coverage. So means these two cities, Singkawang and Pontianak, they are holding the punji of good coverage. So definitely, sir, I will discuss these things like to involve this university in pink polio campaign with DHO, and I'm hoping that he will definitely come to you, or you both can have a good coordination meeting so that the coverage can be enhanced. And I think definitely the children of city Pontianak will be very thankful to this university for their support in making a possibility of having those children receiving polio vaccination. Otherwise, sir, I think most children will be deprived and they are at risk of getting the polio. Thank you, sir, very much, and definitely I will communicate this with PHO also and DHO also that you all are ready to support. And previously also you have supported dengue stunting, you are supporting also dengue also. So it is very easy for you to support the program. So I think it is it's a win-win situation for this university also, for DHO also, and for the children also to get the polio vaccination. So once again, thank you, sir, for all your support. And my task is to communicate with DHO Pontianak so that he can contact or coordinate with you. Actually, sir, once DHO office will coordinate, like when they are going for sweeping, so your students can go along with the team and to look for the houses where children are there, and if somebody is not taking the vaccine, they can convince them. And I think it is the same like changing the behavior of people, like from not taking the vaccine to taking the vaccine. So I think that can be of use support if your students are moving with the team in field, because that will give a team of people moving to houses, and then if 4 or 5 people they are convincing a person to take the vaccine, then they can easily take the vaccine. I think that can be the best possible method to influence the people to get the vaccine. And I think if, like, suppose if you are supporting 25 or 20 RT, I think this will be a very big number. Like suppose if you are getting one person in one RT, and they can move along with the team, so that will be very different. And the second thing is like that whatever communication channel is with you to deal with the general public, they can be broadcasting a platform like Facebook or like Instagram of this university. I will share some of the video messages of people which you can share with your group also, so that more and more people can see and they can influence others also that this is media. So if I get the number, I will share the contact, I will share all these things. Yes.